Welcome once again, friend. Myself, Dr. Naren Singh Chauhan, and today we will be discussing the most important one-liners in ENT, the part 27 of the series. So, beginning with the today's series, the question number 1, which says that the epithelial lining of adenoids. So, what is the epithelial lining of adenoids? So, adenoid has a pseudo-stratified ciliated columnar epithelium. So, since most of part of the respiratory tract is pseudo-stratified and ciliated one is in the respiratory epithelium to clear out the mucus and the columnar epithelium. So, you have to remember this. Adenoid is lined by pseudo-stratified ciliated columnar epithelium. Now, coming on to the question number 2, which says that if a child goes for adenoidectomy, then what kind of speech problem he or she can suffer? Then, post-adenectomy, most commonly affected or faced speech deformity is our velopharyngeal insufficiency. Velopharyngeal insufficiency. We all know these adenoids are located in the nasopharyngeal area. So when we remove these adenoids, a empty space is created. So soft palate does not close tightly against the back of the throat, leading to air leak. The soft palate cannot close tightly back to the back of the throat because of creation of this defect, which result into the air leak, and this air which should come from the mouth, some leaked air comes through the nose also, so giving a hypernasality in the speech. So in velopharyngeal insufficiency, what will be the nasal what will the change in the voice? The voice will be more hypernasal. So it will be difficult to understand the voice of the person due to more of the nasal component to it. So one other question which can be framed like this is, in velopharyngeal insufficiency, what is the more component? Is this the oral component or is the nasal component? But actually more component is oral only, but still due to air leak the nasal component increases as compared to the normal person. Question number 3, which is that pharyngeal bursa gives origin to. So the pharyngeal bursa gives origin to, this is known as throne wall cyst. So the pharyngeal bursa is a rare and benign congenital cyst. It is a very rare and benign congenital cyst. And what we see in this, it is in the region of pharyngeal bursa. And this bursa is formed by communication between notochord and nasopharyngeal endoderm. Nasopharyngeal endoderm. So here 3 questions has been formed. One question is, nasopharyngeal bursa gives origin to which cyst? And in the option you have to mark it is the throne wall cyst. And what actually throne wall cyst is? Throne wall cyst arises from pharyngeal bursa. It is a rare benign congenital cyst. And how this pharyngeal bursa is formed? Pharyngeal bursa is formed by the communication between your notochord and nasopharyngeal endoderm, which is between notochord and nasopharyngeal endoderm, this pharyngeal bursa is formed. Going to the question number 4, which says that most common site of origin of nasopharyngeal angiofibroma? So this question you have to learn it like this only, because this will be asked like this only in many PG exams. So most common site will be the sphenopalatine foramen. What is the most common site? It is the sphenopalatine foramen. Sphenopalatine foramen. Question number 5. Frog face deformity of nose is caused by angiofibroma. What we see actually in the frog face deformity is proptosis plus this is nasal bridge broadening. Which we see, this is proptosis. The eye will be more prominent and the nasal bridge, which might be like this, will be now this. So the nasal bridge will be broad and there will be proptosis of eye. So frog face deformity of nose, that is angiofibroma, leads to the nasal bridge broadening, and later in the course of angiofibroma, when it increases more in size and spreads, we can see proptosis, but usually it's unilateral, and but in rare cases can be bilateral also. Most appropriate investigation for angiofibroma is CT scan, and what we find in the CT scan, you can go through the image based question of our playlist. So most important investigation is contrast enhanced CT scan. Question number 7. Angiofibroma bleeds excessively. We all know that angiofibroma is famous due to what is unique feature, or we can say the deadly nature of angiofibroma is due to its unique feature, that of the torrential nasal bleed. Means if the nasal bleed starts, it's become very difficult to stop it. So what's the reason behind that? Because the vessels in nasopharyngeal angiofibroma lacks a contractile component. But the vessels, when the bleeding starts, they do not contract to heal out or to seal the leakage. So the bleeding when it starts is difficult to stop. Question number 8 says juvenile nasopharyngeal fibroma is supplied by. There are many blood supplies to the nasopharyngeal fibroma, but the most important one is the internal maxillary artery, which supplies it from back. So we have to ligate the internal maxillary artery before starting the dissection of nasopharyngeal fibroma. So we have to dissect the nasopharyngeal angiofibroma. We have to find out and ligate the internal maxillary artery to reduce the vascularity of nasopharyngeal angiofibroma, since we all know once it starts bleeding, it continues to bleed. So we have to break down its vascularity by ligating the internal maxillary artery. Question number 9 says nasopharyngeal angiofibroma, the causative agent is Epstein-Barr virus. What is Epstein-Barr virus? And two more other carcinomas for which Epstein-Barr virus has been found is, one is the Hodgkin lymphoma, which can be easily asked or commonly asked in PG exam. Second is our nasopharyngeal cancer, as we discussed, and third is our Burkitt lymphoma. So overall, three carcinomas where the direct relation of Epstein-Barr virus has been found is Hodgkin lymphoma, nasopharyngeal cancer, and Burkitt's lymphoma. Question number 10, or the last question of the series, says that most common site of origin of nasopharyngeal carcinoma. This is nasopharyngeal carcinoma. Most common site is fossa of Rosenmuller. Most common site is fossa of Rosenmuller is the most common site where this nasopharyngeal fibroma can arise. So this finishes our part 27 of the series, and in this part we try to conclude our nasopharyngeal angiofibroma and part of the nasopharyngeal carcinoma. The next of the question of nasopharyngeal carcinoma will be discussed in the coming parts. If you like the video, kindly share and subscribe, and stay tuned for more such videos which are on the queue. Thank you.